Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran physician assistant and former compensation and pension examiner. Today I have Rebecca Deming from Provet Legal on, and we're going to discuss a topic that I find extremely interesting, and I've been wanting to do this video forever. So I'm so glad that she's on today to do it because it's something that I think is so relevant to veterans claims, and that's pyramiding. So Rebecca, before we jump in, do you want to, I know you've been here several times and most of our viewers probably know you by now, but for those of them who don't know you, can you tell them a little bit about yourself?
Sure. I'm the owner of Provet Legal. It's a law firm based in St. Petersburg, but we represent veterans nationwide and even some living overseas, and their family members in VA disability claims. And my husband was a 27-year Navy veteran, and I got into this area of practice after working with military members for a long period of time when he retired. So love working with veterans and happy to be on your channel, Leah.
Yeah, and I have never really said this in a video before, but it just came to my mind that I just want to say that I think Rebecca is an amazing attorney and an amazing ethical person. And that's why I have her on so much, because I work with a lot of amazing VA attorneys, accredited claims agents, VSOs, and I think they all are wonderful and do so many things for veterans. But I mean, Rebecca is just top notch when it comes to the way that her brain works, the way that she shows up for her clients, the way that she is very responsive and adds that personal touch, I think is so wonderful. And that's why I've enjoyed getting to know her over the years. And I'm so glad that she's so willing to provide her insights to you guys. So hopefully we can convince her to get her own channel going here soon so you guys can pour into her more often. So I'm going to keep nudging her on that.
Leah, you're making me blush.
No, well, I'm for real. So before I go too off topic, can you tell us what pyramiding is? Essentially, what is the definition of pyramiding in the context of VA disability?
Sure. Pyramiding is basically VA's way of saying that you can't double dip and get paid for the same symptom under a different diagnostic code. So if you've got three different diagnoses that all impact your ability to breathe, and you've got COPD, asbestosis, sleep apnea, and asthma. They're all impacting your respiratory function. You're not going to get three or four different ratings for that. VA is going to say, okay, which one's the highest one, and we're going to rate that one. Or they'll kind of combine. I say combine, that's technically not the right word, but they will loop them under one code and give you the highest rating allowable under law for the one of them.
Yeah, another one that I see a lot is just like mental health conditions, right? So like depression and anxiety, right? There's a lot of overlap in those symptoms. So, and you may have anxiety as a symptom of some of your depression. Also, they may be distinct diagnoses in some cases, but sometimes those things are subsumed in one another. But again, we can.
And for mental health, it's always going to be rated under the mental health diagnostic code. And we can get into how TBI can sometimes be different. But for mental health, it's always rated. So even if you're like, I've got two very distinct I've got my anxiety, and when I've got my anxiety, it makes me not sleep, and I get nervous in social settings and act out, and I've got my depression, which makes me sleep all day, and two separate conditions that have separate onsets and separate, whatever. VA's still going to say, nope, those are pyramided. Those affect your mental health and your ability to function and your social and occupational impairment. And so because of the way that they rate them, you're not going to get two separate disability ratings for mental health.
Sure. So how does VA determine whether a person's conditions are subject to pyramiding?
So they, the kind of overarching answer is they're looking at whether the same symptoms are in the rating code or appear in two different rating codes that the veteran would otherwise qualify for. And then they're going to give you the higher one of the two. They're not going to give you both. The more nuanced answer is there are very specific guidelines in VA's rating schedule that will say, for this one, you can't rate them both. Choose choose the one that most accurately or provides the higher rating for the government. And so there are some where, I always get sort of surprised, with the knee. You can get one rating for limitation of flexion, one rating for limitation of extension, and one rating for instability. There's some nuance, and that's just because that's the way the code is written. So knowing those nuances can be really helpful to maximizing the rating for someone, and also not wasting your time. If you're, like you said, if you've got depression and anxiety and you're like, they're two different things, and you're spinning your wheels trying to get a separate rating, and VA's like, we are never going to give you a separate rating for those two things because they all get rated under the mental health code.
Yeah, or they might even say, hey, guess what? You opened this claim for anxiety, but you're rated for depression, and now we think that your depression has improved. And it might not have, right? But just weird things can happen. Anything can happen.
Mm-hmm.
You got a new headache on your hands, right?
Yeah.
So can you explain the difference between separate and overlapping disabilities in terms of pyramiding?
Sure. There can definitely be overlapping disabilities, and there's things that are related. So you can have, let's say you have diabetes, and your diabetes causes, you get one rating for actually having diabetes, and you get one rating because you've got neurogenic bowel or neurogenic bladder, and then one rating for the peripheral neuropathy. And it's all really related to your diabetes, but it's affecting different body parts and different systems. Then you're going to get those separate ratings for that. But with pyramiding, VA is looking at, is it impacting one body part, one system, one function of that one system? So, it is sort of nuanced. Like on your head, you could have a scar on your face, you could have headaches, you could have dry eye, you could have rhinitis, and you could have a mouth issue, that's all in your head, but those are going to be separate issues because of the way that VA says, no, like one's impacting your vision and that's a separate function. One's impacting your nose and respiration. One's impacting your ability to show up to work because you're getting headaches that are kind of knocking you out too often. And so VA looks at really not just, they look at both the body part, but also what function is impaired. And whether they're separate functions that are impaired. And so they're looking at, can I give you a separate rating for this impairment and this impairment and this impairment? Or is it really all these three things are just impacting your ability to move your shoulder? And so, since you can't move your shoulder, you get one rating for your shoulder, whether it's caused by your clavicle or your, I'm not even sure, Leah, what other pieces in your,
whether it's your
body can
yeah, whether it's your rotator. Another one, headaches. I'm getting headaches. Well, I have tension headaches and I have migraine headaches. And then I also have just generalized headaches, right? They're all headaches, right? Or with the shoulder, it's impacting your ability to move. So like I had a labral tear in my shoulder. I had a rotator cuff tear. I had AC joint issue. I had like 5 bajillion different things wrong with the same shoulder. But I'm not going to get, I'm not actually even rated for my shoulder because it was unrelated to service. But if I was, and if it was, then, it's going to be one rating.
Right.
So what are some of the potential consequences for a veteran if the VA finds that their disabilities are pyramided?
So you're only going to get that one rating whereas you're applying for separate ratings. And so with VA, it's sort of like a Tetris game or something. You're trying to fit all these pieces together to get the highest possible rating, applying VA math, which we did a separate video on VA math. And so some, if you were able to get 4 ratings for that shoulder, like that might move you from a 70% to an 80 or 90% or something, depending on what else you had connected. But because you only get that one rating, you're going to be stuck with that one rating. So understanding that's just, I think there are certain things that you can do sometimes to differentiate symptoms and be like, listen, I qualify for the 70% under this rating code without the symptoms that would qualify under that other rating code. And so I really should get 2 separate ratings because they're, you can distinguish these things and they impact me in 2 distinct ways. Then VA will separate them. I do sometimes see them combine things that shouldn't be combined. So, sometimes we'll have migraines with tinnitus or something, and they give you one rating for migraines with tinnitus. Well, at
Yeah.
least under the current rating schedule, like, and that is potentially subject to change here soon, the tinnitus should get a 10% rating if it's service connected, and your migraine should be rated based on how frequently you're having headaches. And so even if they were both caused by the TBI that you suffered when you got hit in the head and whatever, they're two separate things that should be rated separately. So sometimes when you see those things rated together, you can separate them out and get that extra 10%, which may or may not impact your combined rating. That's why understanding the VA math is really important to know when it's worth putting in that extra fight.
Yeah, I have a friend that's another, a VA attorney. I have, and he was just mentioning to me the other day, he's working on a case for someone that's got neck pain, and they tied in cervicogenic headaches, right? So those, into the same rating. And so those are just, yes, it is caused by his cervical spine condition, but it is a separate, like, as you mentioned earlier about the diabetes, it can affect multiple body systems. So you've got headaches caused by the neck. That's a distinct separate condition.
Right.
Legal fight he's going to have to make, I guess. So, along the same lines, what are some things that a veteran can do to present their case to avoid the pitfalls of pyramiding?
So for some of them, you're just stuck. If the code's written that way, for the longest time, and I think this has been alleviated recently, but you couldn't get separate ratings for gastroesophageal reflux disorder and IBS because they both have that symptom of epigastric distress, or like the bloating and pain in the stomach. And for me, one is exit and one is entry. Like, there. I think of your esophagus and your bowels as two separate body parts, but VA, because the symptoms of were overlapping, and if that's the case, like, you can argue all day long, but if the code is written that you can't have separate ratings for them, then you're stuck. But on some of the more nuanced ones, like one of the ones that we see a lot is TBI and PTSD, because if you got blown up and that shook up your head, it might also be the cause of some post-traumatic stress disorder. And so they could have the same origin, but there's some overlapping symptoms. And so with TBIs, it's really important to kind of look at, most of the time, I think you don't, and we could do we could probably do a whole series on TBIs. Most of the time, you're going to be better rated if you get, instead of having a rating for TBI, you'd be better rated for the individual symptoms underneath. But sometimes you can get a separate rating for PTSD because it's the emotional, the cognitive, behavioral changes that are happening from PTSD, but your TBI is really impacting balance and memory and cognitive function, which is separate from the PTSD. And especially if there are separate injuries. And so you can kind of say it's easier for the doctors. And this is really something, there's medical professionals that will get into it and do some testing and some evaluations to say, no, these symptoms here are clearly PTSD. And on their own, they meet the criteria for a 50 or 70% rating. And then these symptoms are very clearly tied to the head injury. And on their own, they meet the criteria for 30, 40, 70% rating, whatever it is. Then we can kind of argue that VA should separate them out. And that's, I think it's something that's really hard for veterans to do on their own. It's hard for us as legal professionals to do, working closely with medical professionals to separate some of those out. So if you find yourself in a situation where, and I hate to say, hey, it's complicated, talk to a lawyer, but this is one area that I think is just going to be really, really challenging. If you think that VA incorrectly combined or pyramided two ratings and you want to try to separate them out, you probably want to get an expert to work with you, or a couple experts, the legal professional and a medical professional to help separate that out.
So what are there some specific conditions that come to your mind, like the most common ones that are prone to having this happen specifically?
Yeah, the The gastrointestinal ones are ones that, like I said, the TBI and PTSD or mental health and TBI often get pyramided. Respiratory conditions very frequently get pyramided. So asthma, and this one kind of boggles my mind, but sleep apnea
Mhm.
would get pyramided with asthma or COPD or asbestosis. So one is, you have sleep disturbed breathing and you're waking up gasping for air at night, and the other is you have reduced lung capacity during the day because of these other impairments. So in my opinion, they're kind of separate, but VA has determined that they overlap enough because they both impact respiratory, and so you're only going to get whichever one's higher. So if you have if you qualify for a 30% for asthma and a 50% for sleep apnea, um, you're just going to get that 150% for the sleep apnea, and they probably write it down as sleep apnea and asthma.
Can you share some of your insight on some examples of some successful appeals related to pyramiding cases?
Um, sure. I mean, I think it really comes back to having the right medical experts. I mean, sometimes there's cases where VA just very clearly misread the regulations, and they're pyramiding stuff that, like the tinnitus and the migraines.
Mhm.
There is nothing in the migraine rating code that mentions ringing in the ears. So the symptoms of tinnitus or tinnitus are nowhere in the rating code for migraine headaches. So it's just not appropriate because to say that it's overlapping symptoms. And so that one we probably wouldn't need a legal expert to separate them out. We would just, you know, go into the VA schedule of rated disabilities, pull, and I'd probably do a higher level review initially. I might need to end up going to the board um, and say, hey, listen, because they don't overlap, here's the rules and regulations on pyramiding.
Yeah, that's
These need to be separated out and you need a separate evaluation. Um, I'd also be looking at the CMP exam to see what symptoms were shown in there. Um,
that
Go
example
ahead.
sounds like one that would be pretty straightforward if you did a higher level review and you were like, come on, like we know that these two aren't combined, but I guess common sense doesn't always prevail. But I would assume that
Mhm.
another rater would look at that and say, oh yeah, clearly this was a mistake and we need to separate these.
Right. Yeah. And so we have seen a few of those. I mean, luckily, I think that those are rare. I mean, there's not a whole lot of times where they're rating the
Hmm.
um, under one code when it's really multiple conditions that impact different body systems or functions. Um, I think, yeah, the simple ones are pretty rare. But if you see those where it's like, wait a minute, they rated um, my balance and my headaches as one condition or something. Well, that one actually probably wouldn't be that simple because you'd want to be looking at, do you have vestibular migraines, and are you only losing balance at the time when you're having a migraine, or is one like, hey, I'm constantly off balance, and the other one is I have migraines that knock me out for a few hours at a time.
Sure. So aside from accredited VA attorneys, what are some other resources of support that veterans can access when they're dealing with this?
Um, I mean, if you want to get froggy, I like to pull up the VA schedule of rated disabilities and go right to the source. And my favorite resource for that is the Cornell Law website because of the way that they're written. I think it's not paragraphs and paragraphs of legalese. It kind of has
Hyperlinks or
the condition, the code, and then it's written in a way that is pretty easy to find it and break it down. So you can look at it and be like, oh, okay, there is I mean, if you want to read through that, you might be able to find the answer on your own that, yeah, VA is never going to give you separate ratings for two different mental health diagnoses or something. Um, or you might look at it and say, hey, the ringing in the ears is not a symptom listed under the rating code for migraines. So why did they combine those and not give me two separate ratings?
So do you feel like there's a lot of misconceptions that you hear regularly from veterans about pyramiding that you have to dispel?
I think the biggest one is that people just think that every diagnosis that they have should be a separate rating, and
Hmm.
not understanding that VA is really looking. I mean, I think in general, if you step back, VA is looking at least in theory, they're looking at you as the whole person. And so, how do these different disabilities impact you? And so, if you have one thing on your right arm and one thing on your left arm and one thing on your bowels and one thing on your lungs, like, that's going to impact you differently. But if you have like four different things on your lungs, well, okay, we're just looking at how those work together. And you might get a higher rating because of the way that all these things are impacting your respiratory function. But you're only going to get the one rating for it. So I think people just sort of assume that because they have multiple diagnoses, they're going to get a separate rating for every diagnosis that they have.
How often do you actually see that VA incorrectly pyramids things? I know we've talked a lot about like examples of that, but how often do you think this happens?
I mean, I think it's frequent enough that it's worth having this episode and talking about it, but I don't think it's like all the time. I'd say it's probably less than 5% that they're incorrectly pyramiding stuff. So, like 1 in 20, where it should be separated, and they just sort of were like, oh yeah, it's, all from the same injury and therefore it's all one rating. And you're like, no, that's not what the regulations say. And that's not what the medical evidence shows. They should get two separate ratings. So yeah, if
So
I had to put a number on it, I'd say 1 in 20
1 in 20 of pyramiding cases
that
are
are inappropriately pyramided. Yeah.
okay. That's, I mean, I feel like that's a good enough, like, it's not like you said, not that you see it every day, but it's frequent enough that it's annoying and people have to deal with it semi regularly. Um,
Yeah, I mean, I think that kind of brings up a broader issue, not to go down a whole rabbit hole of the VA rating scheme in general is fairly complex. I mean, you can access the schedule of rated disabilities online and you can read through it, but the nuances of how to separate stuff out or pyramid it or not pyramid it or when to pyramid it, um, and how to, if you only claim diabetes, but then the evidence shows that you've got these other tertiary conditions that are caused by the diabetes, that VA should, there's a lot of nuance and a lot of obligations that's on VA. And there's humans at different levels of government employee um, that are applying these complex regulations. And so there's a lot of errors. And I think sometimes people will get a rating decision and they'll be like, but why did VA do this? And it's like, it's like asking why this is going to sound insulting, but like asking why your 2-year-old is tantruming. Um, they because it's, because they're 2 years old, because VA is a big bureaucracy, they're going to make mistakes. Like, I
like,
wouldn't
and
always ascribe a rationale to it or think that you have to have a bigger fight than you do. I mean, sometimes the stuff that we need to fight does require us to get a medical expert that's going to do additional testing and really distinguish these two separate conditions and how they impact the veteran in very distinct ways. But sometimes it's just simple VA error. And
yeah, unfortunately,
if you want to,
there's a human process there, right? So there's a human process
yeah,
and there's human bias, there's human mistake, there's human um, whatever, right? So like any other, major bureaucracy, organization, whatever, there's going to be, unfortunately, things that have to be fixed or relooked at, etc.
yeah. And if it's a really simple, these two things should not be pyramided, and you took the time to look at the code and you feel comfortable filing a higher level review on your own. I know we usually talk about like, hey, if you're getting into appeals, it's worth talking to an accredited claims agent or an accredited attorney. But sometimes, people want to do stuff on their own and they've done the research and they just feel really confident. You can write, you do want to write as much as possible. You probably would want to request an informal conference with the decision review officer.
Mhm.
But if it's really just as simple as like VA to, this rating, I don't want to say VA didn't know what they were doing. This rating officer who wrote your decision didn't know what they were doing. And you can
Mhm.
kind of pinpoint that for the decision review officer, you might be able to get it overturned in about 4 months is what we're seeing. Higher level reviews take currently as of April 2025 when we're filming. Their timelines are constantly shifting, but yeah, you might be able to overturn it on your own by just kind of pointing it out and filing that higher level review.
So I guess in your experience, how has the interpretation of pyramiding evolved over time? And then what trends do you think may, what is it going to look like in the future?
I I think that some of the more complex stuff might be ripe to take on appeal all the way up to the courts and the federal circuit if we need to. Because VA has so you've got the statutes and the regulations that apply the statutes, and then you've got the way that the agency at the lower level applies those regulations. And so sometimes I think there's the agency puts overly restrictive interpretations of the rules on there. And so I think there are some areas where, we could really push back as legal advocates, and try to separate out some of the things that really are affecting veterans in different ways. I also think that some of the testing for TBI has gotten a lot more advanced over the past few years, over the past 10 years. And, in the past, it would be like, oh, we can only really determine what the TBI did when we do a brain autopsy after you pass. And, now I think they're able to do kind of more imaging and more testing and kind of separate out like, okay, well, this is really a PTSD symptom and this is really a TBI symptom. And then, yeah, it's like logic puzzles. Like, you've got to look at the rating code, and especially something as complex as a TBI rating code has multiple different places. You're kind of saying like, okay, you're looking at their medical records and saying they have these symptoms documented. That aligns with the these sections of the rating code. And so we're pulling these pieces together and kind of diagramming it. And if you love logic puzzles, then this is a good area to get into and work on for yourself. If these things make your head spin, don't drive yourself crazy and hire someone to come in and do the work for you and kind of pull it apart and figure out what additional evidence you need.
Yeah, I'm interested to see what happens, and I'm sure we'll do some videos on this here over the next year about what's going to happen with tinnitus and how that's going to get pyramided and lumped in with other conditions. And we won't go down that rabbit hole, but that's going to be one that I think has a lot of talk here coming up pretty soon. And then also the sleep apnea and asthma changes, which, again, we can do some videos when those things come to fruition. I think, especially the tinnitus is going to be a big one for us to discuss.
Yeah. I mean, I think sometimes these regulations come into effect and the changes get made and it makes it easier for us to get certain things separated out. And then some of the regulations that are in the pipeline are going to make it a lot more challenging for veterans to get adequately rated. And so people that were easily getting 90 or 100% for, if they apply now or if they apply after these new regulations come into effect, are going to not get those ratings or have to kind of think about other body systems and other claims that they might have in order to cover the same ground.
Right. Well, that's pretty much I had. Those are all the questions I had. Is there anything that you can think of that we missed that you think is important to touch on for pyramiding?
I think it's just a very fact-specific situation on whether it's something that's simple misapplication of the regulation, or if it's in your case you've got very distinct symptoms, and talking to a professional and kind of working through those things with someone who's had more experience in pulling them apart is going to be helpful for most people. And then, yeah, if you haven't seen the video on VA math, I think this video fits really well into that video in terms of understanding, because there's times where you might say, well, I really want to pick apart the headaches from the tinnitus, and once it's only going to move you from 87 to 89%. Either way, it's rounded up to 90. And so you're picking this big fight and you're not going to get any back pay out of it anyway, or any additional monthly compensation. So if you haven't seen the video on VA math, or the 2 videos on VA math, go back and watch those.
Yeah, definitely check those out. And if you would like to get in touch with Rebecca at Provet Legal, I'm going to put a link to her website in the description of this video. Or you can just go over to Provet Legal, to her website. It's provetlegal.com, right?
Yes.
And you can certainly, have a consultation with her and see if maybe you guys would be a good fit for one another. Also, if you're looking for just legal assistance in general, your local VSO is always an option that you can, especially for new claims, you can always reach out to those guys and they may be able to assist you as well. So as always, thank you for hanging out with us today, Rebecca. And everybody, please drop some comments and like and subscribe so that you can get some more information. And let us know if there's any other topics that you guys would like to hear us talk about in the future.
Awesome. Thank you for having me, Leah. Thank you guys for watching.
All right. See you guys later.